Morning.
Good morning. Good morning.
Patients in the room. Morning, Margaret. Once we hook up the patient to the monitors, we do what's called a timeout, which is a safety check. All right. Timeout.
All right. I am a free bit of
The timeout process that we do in the operating room comes from the World Health Organization, and it is a means to be very careful and to ensure that we don't make mistakes. This woman is 62 years old. She has what's called aortic stenosis. The valve at the top of the heart, called the aortic valve, has become very tight over time, and as a consequence, her heart has to work extra hard to try to push blood through that tight valve. When all the blood can't go forward, it starts backing up, and it backs up into the lungs and causes shortness of breath. So what we're doing today is what's called a minimally invasive aortic valve replacement. So everything else in the heart is in good working order. She'll have about a 3-inch incision on her right chest where we go between the ribs, and through there we can get in there to then replace the valve. Okay, you can ventilate both lungs. It's a fairly straightforward case. Everything went well as expected, so I'm going to just call the family member.
Hello?
Good morning, it's Dr. Lee calling from Robert Wood.
Good morning, Dr. Lee.
We're all done with surgery. Everything went well. She got the valve replaced through the small incision on her right side. She's doing okay.
This is great news. Thank you so very much.
All right, we'll see you a little later, okay?
Okay.
Have a good day. You too. Bye-bye. It is now 9 o'clock. We're in the second room. This gentleman is 74 years old, and like the last patient, he has a tight aortic valve. But in addition to that, because it's sort of been long-standing, the mitral valve is now also leaking. So he's a very good shape, 74-year-old gentleman, so we're obviously going to go ahead and fix his heart. We're going to, again, do this through a small incision on his right side. We will go in to replace the aortic valve and repair the mitral valve. There are many, many studies that show that the more you do, the better you are, and you become a major referral center. But that does not take away from the personal touches that we have with our patients and the personal relationships we have with our patients.
How's he doing?
He's good.
Is he?
Yeah, everything went well. Replaced both valves through the small incision on his side. His heart's otherwise in good shape. He'll be out of the operating room in about 20 minutes. When you're able to go out and speak to the family and tell them that everything went well and that their loved one is doing well is always very, very rewarding. So that's one of the best parts of the job.